Headed into the holiday weekend, you might have a few questions about dealing with the bad air out there. You might be wondering, what if I have outdoor plans or my kids are playing in a baseball tournament? What if I work outside? Maybe even, how do I keep my pets safe? Our Annabelle Sedano sat down with NBC4 health expert Nurse Alice.
When we talk about impacting our health, I mean, we can have those side effects for months.
Absolutely. And some of these side effects can feel kind of minor, more like nuisances, but indeed they are side effects of smoke inhalation. Things like coughing, dizziness, headaches, eyes are watery and burning, nose, throat irritation. Those type of things are minor symptoms that we kind of brush off, but really smoke inhalation and poor air quality can impact those and cause those things to happen for weeks after the initial incident.
At what point does it become dangerous? I mean, could we go outside for 30 minutes and be okay?
I'm not going to advise staying outdoors for a prolonged period of time, and I'm going to call 30 minutes prolonged period of time. Now, if you're running to the car to grab a grocery bag and come back in, that's fine. But if you're going to be out any longer than, I would say, 10 or 15 minutes, you definitely should have an N95 mask on, and then just evaluate, do I really need to be outside for this prolonged period of time? Is it something that I could possibly do later? Because that extended exposure to smoke can really cause some detrimental health issues.
What about going to the beach? Is that a safer option?
I wish it was, because I love going to the beach, but you're still outdoors. And what we know about these fine particles is gas and smokes. They can travel for hundreds to thousands of miles away from the initial fire site. We don't need to see smoke. You don't need to even smell it, but it can still be in the air.
For people who work outside, many of them don't have the luxury of taking a day off or waiting for the air to clear. What do you advise them?
Yes, it's very challenging when we have to be at work, but in conditions like this, when there's poor air quality, your health is really still at stake. So I advise people in those situations to, first do a self-evaluation. If you're someone who has pre-existing medical conditions, that's the time where perhaps you talk to your employer, talk to your boss, and see if there's a way to reschedule said work, or maybe you can do something remotely or just differently. But then also, if you feel like you need a little bit of backup, talk to your healthcare provider, because for people who have pre-existing medical conditions, it actually can be very harmful for you to be outdoors. And if you're outdoors for, let's say, an 8-hour day, okay, fine, you did the work, your boss is happy, but that could land you in a hospital visit or an extended hospital stay for actually, several days. So I think it's a very important conversation to bring up. But if you have to be outdoors, wear an N95 mask, make sure you take frequent breaks, and then even when you get home from work, make sure to remove that clothing when you enter, shower right away. We don't want any of those outdoor particles getting indoors and then circulating inside.
What about our pets?
Oh, pets too. Those are extended family. So just as much as, we love our pets, we want to take care of them too. They too, the particles, those can land into their fur. And then they're running around the house, on the couch, in the bed, and then it further, spreads everything, and you can still have exposure. But we want to take care of them too. So make sure that you're washing them frequently. And then also, they don't need to be outdoors perhaps as long. I know that we love going to the dog park, but maybe this is the time that they hang out inside with you.
Nurse Alice, as always, thank you so much for your time.
Thank you for having me.